The STA specifically has increased productivity because one of the big things, again in pediatric practice, that we tried to avoid was working on bilateral areas of the mouth because of the risk of the child biting themselves. Now, without any lip anesthesia and tongue anesthesia, we can do that routinely. So things that I would, in the past, always do in 2 visits, I now routinely do in 1 visit. And the onset of anesthesia is almost immediate. We anticipate within 2 minutes we'll have profound anesthesia. So by the time I give the anesthesia and just go through the rest of the routine, and we use rubber dam, by the time we get the rubber dam on and talk to the child, we're ready to start. So we've eliminated a lot of downtime. It's caused me to reconfigure how I, when I go out and do my hygiene exams and when I speak to the parents, because now when I sit down to give anesthesia, I immediately do the restoration. And it's a reconfiguration of my time, but it certainly is a time savings.
The productivity in the office has increased immensely. It used to be we would take 5 to 10 minute lulls in between patients to allow those patients to numb. Now we don't have to do that anymore. I mean, I literally can set down the STA handpiece, take the time to put the proper burr in my regular electric handpiece, and go right to work without skipping a beat. The staff likes it because the fact being I'm in the room, I'm constantly working. They don't have to chase me down doing something else that I would normally do during those lull periods.
In my practice, we like to talk about on time, on time, on time. And what I found is the STA system does just that. It takes out that variable of perhaps is the patient numb or not. I'm able to confirm very quickly if the patient is numb. And so we find that feedback to the patient on our email confirmation system that lets us know, and that this is the first time a dentist is always on time for them, is very important to us.
When the STA system became available, people started wondering, well, what's the difference? Well, the major difference, of course, is something called dynamic pressure sensing, which allows a dentist to know when they've arrived at the proper injection site to give an interligamentary injection. It acts as an apex locator, and it allows the dentist to know that they've entered the proper site, if they've left the proper site, if the needle's been blocked, to give a successful single tooth anesthesia injection. We call it an interligamentary injection. And this has a unique application and the ability to anesthetize a single tooth without producing the collateral numbness of the tongue, lip, and face has been a real important advancement.